Today we have sedated matriarch Lioness Shanti Deva and are bringing her up to quarantine where she's going to receive an exam, a nail trim, but also spend the winter up here. Shanti has been declining, and at the age of, she's in her mid-20s, she has been having a hard time with strength in her back end, which can be arthritis, it can be renal failure, it can be different things, and a little bit of just slowing down mentation. And so we definitely want to make sure she's in good hands and comfortable, and putting her in a smaller outdoor space but larger indoor area for winter is what's going to really benefit her and allow us to monitor her closely. So we're going to take you with us in the caretakers today and take you along on her exam. Right now they're fighting the snow and those wheels, but Shanti is safely sedated. Caitlin, you're welcome to go help them. Yeah, I don't feel much help as I'm trying to video. Once you get them going, they go, but snow makes everything harder. So we're going to be rolling past the servals, Tonka, and all the way down to the last room. And Caitlin, do you mind closing the door behind me? Thank you. So they're going to have to do some maneuvering to get the crates turned the right way. They're going to be lifting her into her room. Then we're going to be checking her sedation level again before they begin the exam. So she's sleeping right now. She's been sedated. We're going to check her ears, her joints, do a full exam, blood work, as well as check her hydration, since she's an older cat, and do a nail trim, and then she will be woken back up in the room and spending the winter months up here. They're going to tap her. What they're doing is checking for any eye movement or stimulation. Palpebral reflex is what it's called, to see if she's light under anesthesia at all, because obviously you don't want to pick up a lion that's waking up. And there's no palpebral. And no ear but she loves ear twitches, so she loves her ears. Ear cleaning today will be one of her things. Did somebody grab the check? Okay. I see you, Miss Ava. Did you decide to go outside? So Miss Ava's going outside. The kittens, I don't blame them that they don't want to be in here with a lion and tiger, but Ava, hi beautiful, is hanging out in her doorway. And these, the kittens, update on Ava and the kittens. We're going to be doing a deep clean in their room now that they have been exploring outdoors. And we see some of you hiding in here. I don't blame you. We just brought in Shanti.
Watch her tail, watch her legs. If I could have your help just kind of getting hold of her here.
They're going to be moving her out of the crate. They're trying to be as gentle as possible. You can only do so much with big pound.
Someone move up here. Support her back.
And Elise is using the opportunity to train interns and new staff members.
Got her. I'm going to have her head. ready? Coming in. Call out if you guys are having a problem. Okay, we're good. All right, sit her down. Okay. You two can just back up.
All right, so they've got her in the indoor room.
You're on the plywood.
I see Ava is here.
We're gonna bring her this side.
Hi. Oh, and I see kitties.
Don't roll over on her back. Allie, can I have this?
Interns, can you shut this crate and move it so they have a clear exit if they need to? Thank you. And it's just moving it, and you can roll it down here a little bit to one side so people can, perfect. So as long as they can get by. Thank you guys so much.
Allie, go ahead. Move out of that. Okay, pull the weight.
So right now they're positioning her in her indoor room. Oops, pretty girl. There. In a way that the exam, she can be examined. They have her on a piece of plywood because when cats are sedated, they can't maintain their body temperature as well. And so they want, that plywood helps her being off a cold floor and helps her maintain body temperature. They'll also be monitoring her body temperature. For safety purposes, we use the catch pull restraint around their feet and then one across their neck area. This doesn't hurt them at all, but it is in case they get light under anesthesia, it gives us some time for safety. And what they've stimulated her a lot, so once they let her kind of relax, she might go back a little bit deeper, which is what they want for the exam. And these guys are all roasting hot. It is heavy work. And we're waiting for our tech to join our veterinarian. And then they will be doing, as we talked about, this is Shanti Deva, one of our older lionesses. We're going to be doing an exam on her today since we moved her up to quarantine. She would not walk into the crate herself, and so she was immobilized, which allows us the opportunity to do her nail trim, check her blood work, do a full physical exam, give her fluids and vitamins. Shanti has been slowing down, and a lot of that is she's having a weakening in the rear end, and that can be due to arthritis, old age, as well as if she's renally compromised.
I just wanted to wait till they come in.
And so today she's getting a checkup. We make sure all of our older guys are as comfortable as possible. They've put a bed box in for her, which she's gonna love. This is a bigger indoor temperature controlled room. And then she'll have access to a smaller yard where she can't slip or fall. But this way we can make sure she's enjoying her winter months and her geriatric years as much as she's enjoyed her entire life here at the Wildcat Sanctuary.
While you're watching, if you want one of these guys to be your scribe, I can do that for you so you can watch.
Rest are 75.
Sure.
So right now they're checking respiration before they go in to see, respiration can tell us a lot of how light she might be, especially after all the moving and stimulation. She's taking a lot of deep breaths. And they want to make sure it's safe to go in.
16 for rest. 4 times for 15 seconds. You said still. It's okay. That's why I was like, wait a second.
Tired.
It's okay. No, Robert.
So Elise is going in with this catch pull, and she's going to check her palpebral and make sure she's still good and asleep for the rest of the team to go in. She's putting a secondary catch pole more so over her head in case she were to wake up. What that does is that they don't wake up right away, that she might do some head movement, and that gives the vets restraint enough to either remove themselves from the room or to give her a boost and a bump of anesthesia.
Okay, I'm gonna put I have this, so if you want to be in here while you do your TPR, so you can hold that bowl.
If you're just joining us today, we're at the Wildcat
give me your
Sanctuary,
drum and the,
and we have moved matriarch Lioness
Just
Shanti
the top
Deva
part's good.
from Roar Ridge to her winter area in quarantine. This is a move that we do for geriatrics that need limited outdoor space in the snow, but larger indoor bright space because they're spending more time inside. Shanti is one we've kept a close eye on over the last couple years because she continues to slow down, but in her mid-20s, that's expected. And so most recently, she's having some kind of weakness in her rear end, which causes her to stumble. And again, we're looking at if that's due to age, due to arthritis, due to some renal, her kidneys being compromised. There's many different ways. We're also using this as an opportunity to trim nails because when cats are older, they don't wear down their nails like they should, and sometimes those can grow into their pads, and even if they don't, they can grow longer to the point that it makes it harder for them to walk. We're very thankful when cats have all their claws and no declaw has been done, and that's like Shanti, because they do tend to live longer lives and better lives.
Because I want to send blood with her. Hang on, I'm going to send blood with you.
You can see there's a phone book in the back, and that's not because they read while they're doing vet exams. That's enrichment that is staged here for Shanti, so when she wakes up, she has things to do, and if she has a little bit of nervous energy, she can displace that nervous energy through things to tear up or move around. And Elise is going to get the Dremel tool. Sometimes these little nail clippers do not work for the big guys, and they actually have to use the Dremel tool. We're also going to clean Shanti's ears after we get blood. Today, Shanti tends to get yeast buildup in her ears, which can be itchy. Dr. Joanne here is drawing blood so that we can run chemistry and find out how her kidneys are, her liver, anything else in her geriatric residence to give us any indication of what might be going on, or if she needs more supplemental care, or sometimes like Tonka's, it comes back great and we know we're just dealing with arthritis. But the more information we can get during the sedation, the better off we are. We're going to also start some subcutaneous fluids and vitamins, and that's really to help aid in recovery. And also some of these older guys that kidneys aren't working so well, that helps flush out some of the drugs that we're given, and it also is supportive care for their kidneys as well. I can have Allie come over here and open this from the side when Dr. Joanne is. They have to be, they're on this side. Do you want me to open these?
Yes, please.
All right, so I got this blue one. Oh, actually, that was open. Those ones.
And if you could just hand those to Abby.
And then we check always that both of these are running after we open them, and they're running really well, which means she is getting subcutaneous fluids. Dr. Joanne's feeling all her joints, looking at the back claws and digits, seeing where that lameness might be coming from.
Open all the fluid lines. No, it's still in. So you just her dew claws, or the other one seems like she's weighing them down decently. Makes sense.
Isn't that horrible? Yeah.
So right now, it looks like she's wearing down all of her nails pretty well, except those dew claws. That's the one Elise is focused on trimming.
Putting myself out of the spot.
You can also see that lump, which is the fluids under her skin. She'll absorb all of that. So there's no worries with that there. And if you've seen any of the other vet exams with Tiger Mohan recently on our live posts, you can see how much smaller her feet are. If there is time safely, did we bring the box from the hospital? Can somebody go get the box that's in the prep room? It has the towel, the paint in it, and everything. We'll try and get footprints, paw prints from her. Paw prints are something we do. As you guys know, we've got Mohan's giveaway paw print for Give to the Max. It is something that we only do if there's time and it's not extending any procedure. And Angie, does that box have the ear cleaning too?
Yes, it does.
Okay, you got that. She's got some gooey ears. And then this is the point, so even though she's sedated, cats can kick their back legs or their paws when you go working in their ears, especially if their ears have been itchy from yeast buildup or anything else that might be there. And so we watch for that as well during an exam. Joanne, do you need me to run blood while you're here? Is somebody...
Abby's got it.
Abby's doing it. Okay, awesome.
You want me to
If you're just joining us, we're the Wildcat Sanctuary in Sandstone, Minnesota. We are working on Miss Shanti Deva, one of our matriarchs, a lion from Catskill Game Farm. She came to us in 2006. The Catskill Game Farm was a roadside zoo that also bred animals and sold animals and displayed animals. And when they closed their doors, they had over 1,000 animals that they put up for auction. And we did not want any of these animals going to breeders, dealers, other roadside facilities. And so we had agreed to accept all the cats, which was Aslan, Shanti Deva, Asha, Cougars Max, Mia, and Maddie, and Leopard Shazam. But we refused to take them if they were purchased because several people were buying the animals, and animal rights group were buying the animals, giving these bad people the money, and then trying to give these animals to sanctuaries that would have a lifelong expense. And we agreed if they could secure the animals without purchase, we would provide them a lifelong home, no questions asked. And we're so proud of us and everybody that joined in that we did get them released without having to pay any money except for helping with transport costs. And that's why the bad guys don't get rewarded for selling animals like this. And so Shanti's been here since since 2006. She's in her mid-20s. And as we know, we're doing a geriatric wellness exam and moving her to our quarantine area, which gives her a much brighter indoor area and a bigger indoor area for the winter where she likes to spend more time, and a more controlled surface outside to help with her geriatric body. She's been doing a lot more slipping and tripping with the weakness in her back end, and today we're making sure that it's nothing more than old age and arthritis by running blood work, doing nail trims, taking the opportunity to clean her ears because she also has itchy ears quite often. Dr. Camper has kind of checked out her joints and as much as she can there. She's getting supportive fluids. The yellow line, Angie, is slowing down, so there might need to be moved or needle pulled out. There we go. That picked up. Now it's got stopped again. And sometimes that's just pressure based on. There it is. That's going good.
See.
So she's getting fluids. That's that big lump in her back that will be absorbed naturally through her body. They take her temperature. They look at respiration, check her heart rate while she's sedated. She has a pulse ox on her, which can give us more information as well. We keep their head covered because the less stimulation they have visually, the more asleep they tend to remain, and that's also very helpful for them. The drugs that we give to keep them asleep last about 45 minutes. You know what time frame we're on right now from when we darted? So usually somebody lets the vets know that. They know at what time they're on, how long it's been.
Since the first, it's been hour and 5. First one, we bumped it
Okay. So you're at hour 5 from the first injection, but we know you gave a few more after that, so. And she still seems very asleep. What you hear behind me is the heater in here, and we've kept that on so that she has a warm place to recover. As you can see, it's very snowy outside. Dr. Joanne, when you're done, can you explain what you're doing?
So I'm giving her an injection of iron. A lot of times these older gals are a little
Iron
low in
deficiency,
iron,
so she got an iron,
she also got a pain injection.
another pain injection to give her a boost for pain management in her older years. She is on oral medication as well, but any opportunity we have to boost what they need is important to do while they're sedated.
She has a little cyst or something here on the sample.
So she's aspirating a little cyst near her belly or mammary area. Shanti is spayed, so and we spay our cats because that decreases the chance of any type of cancers and obviously infections like pyometra.
I think I'm pretty good with those. All right.
In good shape, so if she's still good, I can do some of these.
Yeah, did you check the back ones off too?
I did. I trimmed those ones down. They were actually pretty good.
Are you
one of them was
comfortable, Elise, if somebody comes in and does paw prints while you're doing
close.
Dremel?
I just finished the Dremel. So
Oh, okay.
I was gonna do this and then if
All right, so then Elise is going to do a few painted paw prints. Again, we have still fluids
So it could come out.
finishing up.
yeah, I'm good with those. Yeah, but if I do need assistance holding the paw, maybe someone.
I'm gonna take.
So if you're joining us today, we're the Wildcat Sanctuary. We are doing a wellness exam with sedated Lioness, Miss Shanti Deva. Most of you know and love her so much. She's been with TWS since 2006. She's outlived her pride mates, but that's been okay. She was the alpha of the pride, and she seems to have really enjoyed some alone time of not having the responsibility of leading others. We were hoping when the Argentina Lions came that she would find a kinship in them, and she pretty much told Gino right away that she's done her job as a mom and a leader, and that now it's retirement time, and he was told off pretty quickly that Shanti would not be managing another pride. So we love when the animals we care for give us strong communication and messages and allows us to know exactly that she wanted to remain alone, but she doesn't mind having cats near her. And even at an old age and getting some arthritis, she still tells them who's boss. Miss Daisy keeps trying to antagonize her in a very good way, and Shanti lets her know that by no means is Daisy dominant over Miss Shanti Deva. So I'm going to walk over here, kind of come in her room and show some of the paw prints they're doing. They put non-toxic child paint for kids on the pads of the feet, and then we just put them on paper. And we don't always have time to do this on an exam because the medical procedures are what's most important, but we're still giving subcutaneous fluids and things like that, so it's given Elise the opportunity to grab a few wonderful paw prints. Also, the staff will actually go in during muddy season or snowy season and find natural paw prints in the snow or substrate on the ground, and we'll actually do castings of those, and you see that we sell those at our fundraising events as well. And I will tell you, seeing paw prints of cats with their claws is absolutely stunning and beautiful. And trying to get paw prints of cats without their claws tends to look like mush on paper. Great. Dr. Joanne's going to go check the blood work to see if any more things supportively need to be given. Do you want AJ or anything to take anything out of the room, Elise, while you're working on that?
If we're good with that basket, we can take that out.
We've got some stuff behind Angie that can come out. So people ask, how fast do they wake up? Well, if they've just gotten one dose of the immobilization drug, once we do partial reversals, they'll wake up usually within 15 minutes. It can vary based on the animal's age and based on how they metabolize the drug. But depending upon how long she's been out, we'll only do a partial reversal, which allows her to wake up a little more slowly and not feel so agitated. If you've ever had a human or had anesthesia yourself, it can be a little confusing. Luckily, the drugs we give cause an amnesia effect, so she doesn't remember any part of the procedure or anything like that. So that won't cause her undue stress. It's just waking up and metabolizing those drugs. So I know the big question is going to be, one is, what are we doing with Shanti's paw prints? And we haven't decided yet. That's not something we always premeditate. It was just we had the opportunity while we're waiting for blood work and things like that to capture this. And sometimes they end up being memorials. Sometimes they're given to core staff. Sometimes they'll be part of a auction. It's just something very special to us because we are a no contact facility. So we are not treating these animals pet-like, though we do adore and love them. It's just a keepsake of something very special, of a way to remember or honor some of the amazing animals here that we rescue at the sanctuary. So Elise is also gonna take the opportunity to get a nose print. And so she's kept her covered to keep that stimulation. You can see her little tongue hanging out, which is totally her signature, and that's where the pulse ox is. But when she's awake, she usually has her tongue hanging out a little bit. And Elise is going to attempt to get a little nose print. But it's upside down. You know, it's hard to move a 400-pound cat for artistic things.
Do a couple of these and then give her a little purple.
Doing really good.
And we'll have to see what she thinks of Tonka's leftover smells. She's actually in the room Tonka is when he came. Also, I brought that Vetra spray if you want to put anything on those little abrasions she has. So we're finishing up the wellness exam on Shanti Deva, taking the opportunity to do paw prints while Dr. Camper is running the blood work. We don't want to wake her up if we don't have to till we have those results, in case she might need something else, or worst case scenario, we do this in case that we find some medical reason why she is slowing down and deteriorating, and that there'd be a reason not to wake her up. I got the door.
Cut this one carefully though. Let's pause over the clips.
So good. So Dr. Joanne, if you can step in, can you tell us anything you can tell us what you found on her blood work?
Her blood work is surprisingly fantastic.
Even for her kidneys?
Even for her kidneys. Her albumin was slightly high, which means she's a little dehydrated. So that's good we gave her fluids. But her kidneys look good, liver looks good, blood proteins, electrolytes, all look wonderful.
Wonderful. So we just think what we're seeing is old age and some arthritis. And well, we'll take that news, Miss Shanti Deva. We'll take that news that the diagnosis is you are a 25 to 26-year-old lioness.
She wants to be out there in baseball team.
So thanks everyone. We'll obviously give you updates. We're going to be waking her up. We're finishing everything here. There's no reason not to wake her up, and we know she'll enjoy the indoor space. The biggest thing is Tonka's a little bigger than Daisy, so we know Shanti's going to try and give Tonka a run for his money on the shared wall. But keeping her active will also help keep her younger at heart.